What is up, everybody? Welcome back to another video. If you don't already know me, my name is Winston Guest, and I'm having double jaw surgery in 5 days. Today's video is all about double jaw surgery essentials. So if you type in Google double jaw surgery essentials or jaw surgery haul, a lot of people have made a couple videos about this regarding the things that they think are essential for surgery and preparing for surgery and basically your recovery. So I want to do a video on that as well. I think I have a couple more things that people missed or didn't really think about, or maybe their surgeon just didn't recommend them to get that item. But I have a pretty good list that I'm excited to share with you guys. So first thing on the list is the NutriBullet. So, or any blender, by the way. So this is just what I have currently. There are a bunch of different blenders you can buy online that are bigger and wider. But the reason I have this, well, I actually already owned it before, so I didn't think it was necessary for me to buy a new one. But the reason I think that the NutriBullet works is, one, it's very powerful. So it spins very quickly and it's able to basically break up anything that you want to eat. I currently use it without having jaw surgery done yet. I currently use it to make smoothies. So I put in like frozen strawberries, frozen blackberries, frozen blueberries, frozen bananas with some milk, a little bit of an avocado, by the way, that helps thicken up the smoothie. It makes it a lot better, so it's not so milky and watery. And blend it up in this thing and it works really well. But the reason I think this will work really well is because in the first 2 weeks of your recovery, you're going to be on a liquid-only diet that's particle-free. At least that's what I've been told, and that's what I'm going to be doing. The reason you're doing particle-free is because of the sutures in your mouth, the incisions, and the stitching in your mouth is kind of an open wound, and you can't be having particles because you don't want your mouth getting infected, and you don't want any of those particles kind of getting stuck in your teeth. It's going to be hard to clean. So for me, it's going to be particle-free for the first 2 weeks. So this thing might not even come in handy the first 2 weeks. It's really meant for maybe from week 2 to 8, where I'm doing a blended diet of smoothies or mush soups or whatever. But it still might be useful for my protein shakes, where I'm drinking for the first 2 weeks because of the powder mixture. I can still blend it up here if I feel like I need to. But overall, definitely you need a blender. The second item I think you really need for recovery and just in general for oral hygiene is the WaterPik. So this is the current WaterPik I have right now, WaterPik Water Flosser. It's been really useful. I actually got it before surgery a long time ago. It's when I got my braces on. I got this because it would help me clean my teeth and kind of get in between the gums and in between the teeth, and also in the braces. And this is a special pick that's used for the braces. It has like a little brush on top. So fill it up with water. It's very useful. There's 2 settings here. There's floss and massage. And then you can adjust kind of the power that you want the brush to be spraying water out. So I actually originally started at 4 or so. It wasn't that strong, but I had some sensitive gums because of the way my bite is. I only use the back teeth to chew. Food was getting stuck up in there, and when you floss, it makes the gum like sore and bleed. So this was actually making my gums bleed. Don't be alarmed. It stopped very quickly. Once you kind of clear out the gunk and clean the gum line and the teeth, that goes away. And your gums kind of get stronger and healthier. So then I brought it to 6, was doing fine, and then I brought it to 8, just because I think that's a pretty good pressure. I haven't tried 10. I think 8's pretty strong, and that's what I'm using currently. However, when I get out of surgery, I will probably be going back to 4 or maybe even 2. So a very light spray, and just kind of cleaning around the braces, cleaning the mouth, and hopefully just lightly kind of spraying any types of particles or things that were in my mouth previously from protein shake or chicken broth off of my teeth to stay clean. So must have WaterPik. Next item I recommend is getting this ice gel mask, face mask. So I just bought this recently off Amazon. I'll put the link in the description below. But I think this will be really useful for me. And a couple of people I've watched YouTube videos also have mentioned that this was something that they was kind of a lifesaver. Your face is going to be really swollen, and you're given a jaw bra, which kind of goes all the way around your head like this, like a headband, and it keeps your chin up. And also you can put ice on the edges of it so that's not on direct contact. But this thing kind of eliminates that step, or at least it gives me kind of the on top of the face option rather than just on the cheeks. This might just overall reduce swelling and kind of cool down my face, and I think might help overall. It does come with the another ice pack. So this ice pack right here, this is just kind of like a topical ice pack you can use where you want. And obviously this one is a face mask, and it does come with a, or no, I'm sorry. This side is the side that you put on your face because it already has this kind of fuzzy, furry thing that you put on your face, so it's not super cold, and you can stand it, so it doesn't like burn your skin or anything like that. So definitely an ice mask. I think this is going to be useful. The fourth item that I think is really important for oral hygiene, and something that I have even before the surgery, something that I plan to use after the surgery, is a dental kit. So I have this dental kit here called Smile Dent Pro. I've been using it every so often. I don't use it all the time, but it comes with a full set of tools, which include your mirror, your tongs, which I've never used before, and then tools like this one that you see at a dentist when they're cleaning your teeth use. So this thing right here, I just use it to kind of like get in between my teeth, and sometimes I also use this mirror to kind of see where I'm going. Your teeth can kind of get stained if you're drinking coffee, stuff like that. I use this thing to clean it. And then I also use this to clean kind of the gum line and the plaque that might be building up. You know, when you're like moving your tongue on your bottom teeth or around your teeth and you kind of just it feels like grimy a little bit. This thing comes in handy because what I do is I just then shine my iPhone light into my mouth and look around at the gums and look at my teeth, kind of inspect them, and then clean it with this. So this is not something I expect to be using within the first 2 weeks. It's probably something that I expect to use starting week 2 once I've kind of got elastics I can open against. I've got the WaterPik, which I think will kind of help me start from day 0 to day 14, the first 2 weeks. Well, then this will I'll graduate to this later, but this should help kind of clean and scrape out my teeth if I need it. The fifth item that I recommend and that I'm using for my jaw surgery recovery is going to be condiment bottles. Those condiment bottles right there, I have ordered and they're going to be coming tomorrow. I think they're going to be really useful for drinking liquids in the first 2 weeks. The surgical bag they give you, or you should get when you leave the hospital, will probably have things like a syringe, maybe a sippy cup, some chapstick, other stuff like that. But I think having these bottles are going to be really easy because the top screws off and you can fill them up with a lot more liquid and a lot easier. You don't have to kind of use a syringe to pull the liquid out and then spray liquid into your mouth and eat very little. So I have 2 condiment bottles coming, and I think those are going to be really useful. Another item that I ordered and is not here yet is a wedge pillow. So this is what a wedge pillow looks like. A wedge pillow, 30-degree angle pillow, memory foam that I'm going to use to sleep against because you're supposed to sleep elevated for, I'm not sure how exactly long, but I think it's around 2 weeks, possibly more. I think it's 2 weeks. So I think the wedge pillow is really useful because a lot of people probably just use a ton of pillows, but the pillows don't quite give you that firm support on your back and neck and stuff like that. So I think a wedge pillow will kind of be a larger structure and more hard and durable that I can lean against, and then after that I can use pillows. So I think a wedge pillow is going to be really awesome, and a lot of people have recommended it on their YouTube channels, so I have that coming in the mail on Friday. Another item I have is a neck pillow. So I actually have 2 of these. This one is like a harder, firmer one. It's kind of like a memory foam. You can squeeze in and kind of hold its shape a little bit. But I also have another one that's just those foam beads in there and really is like malleable. So I have 2 different ones. Obviously I use these for flying, but I think they're really gonna come in handy when recovering as well, because when I'm on the couch and just chilling out, or even if I'm on my wedge pillow but my neck isn't supported, I'm gonna feel really like tired and just annoyed and bothered. So having a neck pillow and just laying against the couch like this is going to be pretty nice. So I recommend this one or a bead one that's just kind of like a circle and doesn't really have this kind of U-shaped structure. And I think those will be really helpful. Okay, a couple other things that I kind of want to rattle through quickly because I think the video is getting too long. Items to purchase that I was told from my surgeon. And I'm going to look off screen here because I have these things listed, and I'm going to go get them physically at like a Rite Aid store. They are liquid Mucinex Sinus-Max. It's an over-the-counter drug that you can get to treat daytime congestion. Liquid children's Benadryl, also over the counter. Treat minor allergic reactions, used for nighttime congestion, and if needed, used for sleeping aid. Q-tips, clean the opening of your nostrils and the corner of your mouth. Also, make sure that you have salt. Salt is used to make the oral soaking solution. Your surgeon, I'm pretty sure, will prescribe you a couple different things to clean your mouth. One is like a mouthwash that they might actually give you, has like a chemical mouthwash, or one you might normally expect when you buy at a store. But other than that, you could also use a saline solution. So the salt is used to make that saline solution with a little bit of hydrogen peroxide. And you add in there, that's kind of like a disinfectant type thing. Another thing is liquid Tylenol and liquid ibuprofen. See pain management schedule. So that item is not really necessary, I don't think. They just say that if you aren't able to manage your pain and it's still hurting you for whatever reason, maybe those are going to be good to have on hand. I'm expecting to not be in pain after the 5th or 7th day. That's when your pain meds, or at least for me, are done. So I'm not expecting to be in much pain after that, hopefully not, and I think it'll just be tolerable. So the last few things that a lot of other people on YouTube didn't mention that I think will be helpful and that are suggestions from my surgeon are a strainer. If you don't have a strainer, definitely get one so that you can kind of filter your liquid so that when you're drinking the first week or two, it's particle free. You won't get infections, it reduces the risk. So definitely find a fine mesh strainer. The other thing, thermometer. Now, typically the thermometer is one that you put in your mouth or under your tongue. You're not gonna be able to do that because your mouth is wired shut. So they say maybe get one that's usable on the forehead, ear, or under your armpit. So there are those like readers that you can put in your ear, and those can also read your temperature. So maybe one of those. A humidifier that is used to ease congestion. So kind of makes the air damp and reduces the dryness in your nose and stuff like that, and kind of helps reduce congestion. And last suggestion that my surgeon says is a big fluffy pillow. Obviously, we probably all have a bunch of flip pillows, but if you have like decorative pillows that are bigger and used for like couches, those are gonna be useful. If you're not getting a wedge pillow, then definitely use something like that rather than just a bunch of like sleeping head pillows. I think that will be help, and I think that makes sense a lot. Surgery bag contents. Everybody's surgery bag contents are different. I kind of mentioned this earlier. You'll probably get a syringe. You're probably gonna get some lip treatment. It says Blistex. I think there's a thing called Aquaphor, which is like a medicated lip balm. Your lips are gonna be cracked, so that's gonna be useful. Vaseline is used for the brow stitch only 3 times a day. No Vaseline on lips after surgery. That's what my surgeon says, all bold. So if you're using Vaseline, don't use it on your lips. Use Blistex or Aquaphor or something else. The Vaseline is only used on your brow stitch if your surgeon uses like a headpiece to kind of keep your jaw in place and makes an incision here, and sometimes an incision here or here. And those are used to kind of heal up those scars and make sure they don't dry out. A toothbrush, I ordered a toothbrush, but it's a baby's toothbrush. They mentioned that as well, child's toothbrush, so I should be getting that next week. Sippy cup. I'm gonna have a syringe and the condiment bottle, so not necessarily needed for me, but something you might consider. Another thing is a recipe booklet. So I'm gonna make my next video, which is about how I'm preparing for the surgery in terms of like mental, physical, and ingredients, stuff to eat, like how am I planning out what I'm gonna be doing. So definitely a recipe booklet on liquid only diet or stuff that has like a bunch of milkshakes and smoothies. And last, another suggestion is the Simply Saline Spray. It's an over-the-counter nasal congestion spray. So they ask you to purchase a liquid Mucinex Sinus-Max that's used for daytime congestion, but they also have that Simply Spray for your nose, and that should help you a bunch. All right, guys, thanks for watching the double jaw surgery essentials. I know it's a long list. There's a lot of different things that I think will be helpful, and I'm kind of combining things that I've learned from 4 different surgeons that I've talked to and gotten their lists. So things might vary for you. You might get different things in your surgical bag, like I mentioned, but I think these are a really good starting point to make your double jaw surgery recovery a lot easier. Thanks for watching. Stay tuned to my next video. It'll be my last upload before my jaw surgery, and I hope to see you guys there. Thanks for watching again. I'll catch you next video.